Yeah, so almost we are about to start right now.
Okay.
I think our host is just right there, and we are almost to start. Thank you so much.
You are looking smart today.
Appreciate that. You too, sir. Thanks.
Yeah. Good morning, sir.
Good morning.
I'll begin the event.
Sure.
Okay. Tashidalek and fresh good morning to one and all. My name is Chudon, and I would like to welcome you all on our second day of second free medical consultation camp organized by our NGO, Patient Care Trust. Let me brief about our today's schedule. At 10, we'll have a talk by our director, followed by health awareness about cancer by Dr.lalit Kumar. From 11 to 12, consultation with respective doctor. From 12 to 2, lunch break. Again from 2 p.m. till 4, continuation with the consultation. Now I would like to invite our Director, Mr. Sonam Wangela, to speak a few words.
Very good morning to all of you, especially the honorable doctors. Without your kind support, it won't be possible, to benefit, especially during this pandemic. So, dear respected doctors, it has been a challenging years all around, and in particularly due to the COVID-19 with regards to access to medical care. Let me give you a very brief introduction of our NGO, please. Our NGO name is Patient Care Trust, was named and blessed by His Holiness the Dalai Lama. We got it registered in 2014. The center office, our central office is located in Tibetan Colony, New Delhi. My name is Sonam Wangel, and I am the founding director of this NGO. Our leading advisory members of the NGO is His Eminence Professor Somdorumbochi, Venerable Lama Lobsang, and Kasurinchen Kandro Chogil, the sister-in-law of His Holiness the 14th Dalai Lama. His Eminence Professor Somdorumbochi is one of the most knowledgeable spiritual master in our time. Dear respected doctors, thanks to your continued commitment, we have been able to help numerous patients to receive quality health care through your kind support during this global pandemic crisis. In addition, PCT has been arranging medical camps to allow the maximum numbers of patients to be consulted by qualified doctors from reputed government hospitals. During the COVID-19 pandemic, we have adapted to the situation by facilitating online and site camp consultations, advice management to ensure vulnerable patients who are unable to travel because of the restriction during this pandemic could still access quality healthcare through your kind support. Given the productive of the medical camps, we plan to undertake both virtual and site medical camps on regular basis throughout the years in the future with your kind support. Following on from our first successful online virtual medical camp just last month with the support of many honorable doctors from National Institute of Tuberculosis and Respiratory Disease, Delhi, Safdarjung Hospital, Delhi, PGI Chandigarh, Tanda Medical College, Himachal Pradesh. Once again, we have the honor around 20 doctors, super medical specialists from 15 different departments of All India Institute of Medical Science, AIIMS, New Delhi. I express my deepest gratitude to our honorable and long-term supported doctors for being a part of this virtual medical camp organized by Patient Care Trust on 10th to 11th February 2022. The honorable doctors are essential in delivering medical expertise to the vulnerable community by way of PCT's free medical camps. These have been a linchpin to provide a medical facility to a large number of needy patients, and with your continued kind existence, we have been able to host our first and second ever online medical camps in 2022. Looking forward, we remain convinced that our cooperation is a key to securing and bring proper healthcare in a vulnerable community stuck with hardships. PCT also conducts activities such as virtual and site-free medical camps in remote areas with the support of qualified specialists from these high medical institutions. The beneficiaries typically live in isolated from PCT plans. Once again, the PCT team is humbled and honored by your kind support. We would like to thank you so much, and as well as wish you all a most auspicious and bright new year ahead. Thank you so much. So thank you so much. Thanks so much to all the doctors, kind doctors. Appreciate that.
Thank you, Mr. Sunamangala. Next, we have health awareness talk about cancer by Dr.lalit Kumar. He is the HOD of Oncology Department in AIIMS-Delhi. Sir, please.
Yeah, sure. Share me. Okay. So, school me. Good morning. So, what I plan to do is that to share some of the thoughts and what is the current state of problem about the cancer in India and in general globally, and also what are the various preventive measures which we can use. So cancer, as we know, is really one of the important issue, and among the non-communicable diseases after diabetes, hypertension, this has become one of the major health problems across the world. Now, if you see this slide, China has the highest number of new cases of cancer, followed by USA, and India is on number 3, followed by Japan and Germany. So this is almost 6%, 6.5% of all new cancer cases in the world, which is approximately 18 million new cases in the year 2018. Now, what we have been doing in India, that we have now population-based cancer registries and hospital-based cancer registries. We have in fact 38 population-based cancer registries, which are located in the different parts of country. Some are in metros, and recently, in last decade, they have started the registry in the rural-based areas also. In addition to, we have in the hospital-based cancer registry, so the patients who are coming to hospitals, their data is being recorded and being analyzed. Then also the 46 special studies also have been carried out by the Cancer Registry Program of Indian Council of Medical Research. So this still covers only 10 to 12% of total population of our country. So therefore the assumptions and some of the conclusions which I will be sharing with you have this limitation. Now, if you see the incidence both in men and women across the country, the Northeast has the highest incidence, and followed by some of these metros like Bangalore and Chennai, Mumbai and Delhi and Bhopal. And then we also have some of the other states where the incidence of cancer is there. Now, if you look for the most common cancers among men, in the country as a whole, the lung cancer, oral cavity, stomach cancer, colorectal cancer, and pharynx. These are the most common cancer in the country. And if you compare them with the developed world, that means like North America or Western Europe, where the prostate is the most common cancer and followed by lung cancer, then we have the colon and bladder cancer. While in Delhi, or if you see the Patiala, which is a little closer to the Punjab part, so like the food pipe cancer, which is very common in men in the Punjab part state. My guess is that we have seen quite a good number of these cases of stomach cancer and food pipe cancer in the Tibetan people also. So I do not know whether we have any clear registry for the Tibetan population in India to know that what is the most common cancer. But my guess is that we have probably the stomach, the food pipe, esophagus, stomach, and the liver cancer, one of the common cancers among the men and the Tibetan population. Like in Delhi, we have the lung cancer, which is then followed by mouth and prostate, tongue and larynx cancer. So there have been some differences across the country in different parts if you take as a whole. Similarly, in women, we have the breast, followed by cervix cancer, then colon, ovary and lip and oral. But if you see in the Delhi, we have the gallbladder cancer as number 3. And similarly, in the Punjab part, we have the breast, cervix, followed by food pipe cancer. So food pipe cancer really is one of the major cancer, both men and women in the Punjab and adjoining the Himachal Pradesh also. And the gallbladder also comes number 5. But if you see on the first column, the developed world, the gallbladder cancer is not actually a problem in the developed world. And also in South India, gallbladder cancer is very much less common compared to what we see in Delhi or northern part of India. The incidence of cancer is higher in the urban areas compared to the rural areas. So on the slide on the upper panel, you see we have compared the Mumbai versus Barsi. Barsi is a rural-based population in the Maharashtra, which is a little 2 hours journey from Mumbai. So if you can see that for all the cancers like breast, cervix, lung, and all these like colon, stomach, food pipe, for all these cancers, the incidence is higher in the urban population compared to the rural areas. Similarly, we have on the lower panel from South India, you can see the Chennai, which is the metro city, and Dindigul, which is one of the rural belt population, rural-based population, while going to Pondicherry. So this area, so we have the data from these two population comparison, and again you can see the incidence is significantly higher in the urban areas compared to rural population. For example, breast cancer like in the Chennai is 47.7 per 100,000 compared to 19.7 per 100,000 new cases in Dindigul. So which is like almost less than half. Similarly, in Mumbai is 33.6 versus 13.2. So definitely the incidence of cancer is lower in the rural population compared to the urban or metro population. The other problem which we are facing in India is that we have only about roughly 20% or 25% of people who come with the early disease, or you can call them localized disease. So if you see these bar diagrams, while the loco-regional, that is the advanced, where that is spread to the nearby lymph glands or to the distant parts. So this almost 75 to 80% of the cases, they will have the advanced disease. Like you can see in the breast cancer, 57% have the locally advanced disease, that means stage 2 and stage 3. 10% have the distant, that means stage 4, while 29% have the early disease, which is kind of opposite if you compare to the developed world, where the incidence of early breast cancer today is almost 60%. So similarly, in the cancer of head and neck region, like oral cavity or tongue or voice box, again we have only 26% people who come with the early disease, while 66% have the advanced when it is spread to the nearby lymph glands. Same thing in the lung. In lung, in fact, we have the 44% people who come with the already spread to the other parts of the body. And the same trend you see in the stomach cancer, where 25% people come with the spread to the liver or to the other structures much away from the primary organ, that is the stomach. So that really creates a problem, because in early stage your outcome is much better. Almost 80% people can get cured, while those who come with the advanced disease, when it is spread to the other part, we call distant metastasis, the outcome is just about 20%. Those who have the loco-regional or spread to the nearby organs, lymph glands, then the outcome is nearly 40 to 50%. So what we have seen in the last 2 decades, that there are certain cancers which have been gradually rising in our country, India, and we have in men is about 2.7%, in women is about 3%. So like the colon cancer, rectum cancer, lung cancer, breast and uterine cancer are gradually rising. The incidence of breast cancer has gone up by 4.7% compared to the 3% in the other cancers in women. While cancer of cervix, the incidence is gradually coming on the declining trend. So you can see some of these pictures which have collected the data over last 3 decades from different cancer registry, especially from the metros like Bangalore, Chennai, Delhi and Mumbai. There has been slow increase in the incidence of the colon cancer or rectum cancer or lung cancer in women, and also the breast cancer, which is a little much steeper compared to these remaining 3 cancers. And what are the possible reasons why the incidence of breast cancer is rising in India or across the world? I think what we can probably say that there is more awareness, there are better facilities for diagnosis now, and in earlier days the women will not come forward for the treatment because they thought this was cancer was a taboo, that they probably will not social stigma was there. So now gradually these things are coming down. So more people come forward for the taking a medical opinion. There has been industrialization and urbanization across the country, which also is considered to be one of the reasons that why incidence is rising. This has led to change in our lifestyle, and now there are late marriages and decreased childbearing and breastfeeding. Also, our diet also has changed in the last 3 or 4 decades. People are more overweight and less physical activity, and there is more exposure to the exogenous hormones. So all these factors probably are responsible for we are witnessing a epidemic of the breast cancer, which is gradually rising in the last 2 decades or so. It's expected this number is going to increase further in the next 2 or 3 decades, and probably similar to going to be what we see in the North America. If you see the other cancers like prostate cancer in men, again there is a slow rise all over the country. Uterine cancer, again there is slow rise, and even the ovarian cancer, again there has been rise in the incidence of ovarian cancer. Now this is the cervical cancer, which has been gradually on the declining trend across all the metro cities, and also from Barsi, which is a rural-based population. So that means better awareness and better hygiene, probably one of the factors considered to be responsible that why the incidence of cervical cancer has been on the declining trend. Now, if you just want to know what is the risk of developing cancer in lifetime for an individual. Now, these are some of the estimates So please do not take them this are going to apply to each individual person. But in general, if you want to really find out what is the probability, so like for example, lung cancer in the men, there is almost 1 in 60 or 1 in 70 person may develop lung cancer in his lifetime. Similarly, cancer of mouth, which could be like 1 out of 100, prostate 1 out of 125, and similarly the stomach cancer 1 out of 160. While if you see in women on the right side, the estimate is that 1 out of 30 women is likely to develop breast cancer in her lifetime. Similarly, like ovary and uterine cancer, the risk has been estimated, and lung cancer in women. In general, in overall, if you see, like both men and women, then 1 out of 9 person likely to develop cancer in his or her lifetime. That's the estimate by ICMR based on the data which we have collected over the years. Now, often the one question is asked, what is the cause of cancer? Cancer, there is not a single definite cause. This is a combination of multiple things which really happening. One, that we change in our lifestyle and in our environment around us in past 3 or 4 decades, which finally has really led to this kind of thing. And secondly, this also has led to our immune system, which is responsible for fighting out the infections, for fighting out any kind of disease, that probably have become more vulnerable, or you can call that has become weaker, so therefore not able to handle if one of the parts in our body or one of the cells in particular tissue or organ in our body becomes mutated or changed, and then cancer can gradually start developing. And also in a small percentage of people, some people who have a tendency because of their strong family history or some of the genes which they carry, they can make them prone can to develop cancer. So this is a really combination of all the 3 factors like lifestyle and environment, our immune system, and the genes, which finally leads to development of cancer in an individual. Now, some of the lifestyle factors which we are very familiar, like tobacco in different forms, people are using either chewing or smoking. Then the diet, which we are using, like the fried foods, high-fat diet, red meat, or processed food. So all these things are really responsible that have changed the increased incidence of cancer in general all over the world. Alcohol intake, of course, is one of the very well known for the time immemorial. The environmental pollution, the infections, obesity, and physical inactivity or sedentary lifestyle. And finally, stress also probably adds to some of these factors and make the person prone to develop the cancer. Now we are very familiar, you must have seen these common scenes, people smoke or people chew tobacco in different forms, even the pan masalas and all those things, hookah, etc. They all are equally bad. None of them is better or worse. They all are worse and they're bad for the health. So one should try to avoid as much as possible any form of use of tobacco in any form. And if you see like how the cancer of the tobacco really leads to the cancer burden in India. So like 5 years back, this was the estimate by ICMR that almost 47% of all cancers in men in India are related to the tobacco is one of the important cause to cause these cancers. And women, this nearly 14%, so 43% in men and 14% of women. And if you combine both of them, so 29% of all cancers in India are linked to the tobacco. So if you can stop tobacco, if you can use of tobacco in any form, so 30% of your cancer's burden is likely to come down significantly, which will be a huge achievement. Now we can see that, and I say this because the cancer does not develop in one day or 1 month or 1 year. This is a long process. people may take 10 to 15 years, 10 to 20 years, sometimes longer also. So for example, the cancer of mouth or cheek, which is so common, or tongue, we can see that the people may, because of using these pan masalas or tobacco, chewing tobacco, can lead to the picture like submucous fibrosis, which is one of the precancerous condition. And this is only after a number of years, and people continue to misuse use of some of these substances, then they can develop the cancer. Similarly, cancer of cervix, where we know that the HPV infection, human papilloma virus infection, is one of the identified infection organism virus can responsible for the development of cancer cervix. But if you see, this is almost 15 years, the repeated and persistent infection can lead to the development of cancer finally. So you have enough opportunity, almost 10, 15 years of opportunity that you can really intervene and can reverse this process of development of the cancer of cervix. And for this, we now have the two vaccines which are available, both by Glaxo company and the Merck company, and some of the areas where people have been using these, and there is long-term data now, 10 years and 15 years follow-ups are available, and the incidence of cancer cervix can be clearly prevented by using of these vaccines. And in fact, data from India has shown that even the one dose of vaccine is good enough. So the young girls from the age of 9 or 13 years to 26 years, that is the best time to really give these vaccines, so that to avoid development of this particular cancer in future. And third example, like colon cancer, which is again because of the diet which we are consuming, which really has been increasing over the time. Again, this is the one cancer which gives you enough time, again 10 to more than a decade. Initially, there is a formation of a small growth we call a small adenoma, which if undetected or not treated, then can lead to the increase in size, large adenoma, and finally development of cancer. So these are some of the examples which I shared with you. That means the cancer is a long-term disease. This is not a disease of one day or 1 month or 1 year. Now, we know that father of health, Hippocrates, who was Greek physician, more than 2000 years ago, he said, let your food be your diet. He always believed that most of the diseases which we have, they arise because of the improper food intake. And now we know that very clearly that some of these cancers where we have the diet has been linked, like the high-fat diet with the breast cancer, especially after menopause, prostate cancer, colon cancer, where the high-fat diet has been linked. And some of the parts in our country where the people consume high fried food, spicy food, which has become so popular these days, and especially junk food, some of those things, or smoked food, they are responsible for some of these cancers of food pipe, stomach, or to the oral cavity. Similarly, like you can see some of these pictures here from the parts of Northeast, the food which they preserve, so a lot of these preservatives, and they are responsible, and some of these spices being used, responsible for development of some of these cancers of mouth, as well as the food pipe and the stomach and colon cancer. Now, third thing which really has happened in India and across the world, that people are getting the overweight. So obesity is coming up another epidemic, which is going to really take a huge toll on the health of the people. Now, there is now clear link that people who are overweight or obese, which we call in terms of BMI, body mass index, which calculated the body weight in kilogram divided by the height in meter square. So like those who are overweight or obese, they have the high risk of developing breast cancer, especially in women after menopause, or colon cancer, food pipe cancer, and kidney cancer, uterine cancer, gallbladder and pancreas cancer. and some of these cancer can be very, very difficult to treat. Now, infections, again, like apart from cervix, the other thing which I like to draw your attention is particularly the hepatitis B and C. Somehow that is another infection which I think the incidence seems to be higher among Tibetan people. I do not know the reason why the incidence is higher. Probably some sort of survey may have been done. So one really has to see that the people are vaccinated in the school itself, children. So all children should receive vaccine for hepatitis B, which has led to the reduction in the incidence of liver cancer, especially like Hong Kong, Taiwan, where the incidence of liver cancer was very high 20 years back. Now the incidence has really come down after this vaccination. And many other cancers like NITRD, etc., which again is common problem in the northeast part and some of the people from Mongoloid race. Some more viral infections which rarely like we have the disease like Hodgkin's lymphoma, Burkitt's lymphoma, where the viral infections are responsible for development of some of these cancers. The environment, when we talk of environmental pollution, I mean the picture on the left corner, the top left corner, that's the pollution what we have one of the times in Delhi where you have this kind of pollution. Obviously it affects your health. Then you have the household pollution. You can see this like in the closed space, which can lead to this, or sometimes the spray of insecticide, pesticides, or contamination of groundwater with the arsenic, especially in some parts of India, like in parts of Bihar, parts of West Bengal, and Bangladesh, where the incidence of groundwater contamination by arsenic is very high. They not only have suffering because of some of the problems with the arsenic, especially the skin problem, but also some of the skin cancer incidence also is higher in these areas. Then also one should remember that some of these petrol pumps, they are also one of the important source of environmental pollution, the petroleum products, which finally can lead to some of these cancers. Okay. We are very much aware of some of these pictures, like this picture from Second World War, and maybe some of you may have read this book. So the picture is from this book only. So in the Second World War, the Italians and Germans, they sprayed this gas called the poison war gas or bustine hydrochloride. Later it was found to be useful for the treatment of lymphomas. And this war gas killed thousands of soldiers actually in the Second World War. So some of these things, they are really responsible for some of these cancers. So now the question comes, are there any way how we can really prevent these cancers? Obviously, as I said, that like if you see the burden again, the cancer burden in India, both men and women, so like breast, cervix, oral cavity, ovary, lung, stomach, colon, food pipe, esophagus, and some of the leukemias also. So these are some of those, like if you take the breast, cervix, and oral cavity, it is almost 34% of all cancers. That is like 1/3 of cancers which are clearly preventable. And as I said, the tobacco in different forms, so awareness that we have to stop tobacco use, educating people, educating the school children and the community in general. And unless the participation of community is there and we develop some of these services so that people really find some alternative and stopping use of tobacco, that's something very important. Stopping alcohol again is very, very important. And the diet, we should promote the use of vegetables, fruits, salads more, and avoiding the red meat, and try to avoid or moderate amount of the fat consumption. Similarly, we have to be very conscious, try to maintain the weight in the normal limits, try to the body mass index, which is like 23 or less, that's considered to be the normal. So we should try to make sure that we do not put on the weight. And regular exercise is something which is very, very important to keep yourself fit. And those wherever possible, some of the suspected areas, we should try to control the infections. and 10% of cases where there could be strong family history, where the more than 2 members have suffered. This particularly so in the breast, ovary, and colon. There, now we have the genetic counseling, and some of these cancers, like so, for families with one of the mother has suffered, then for the daughters and other members, counseling services also are available. How to detect that whether the children may be prone for developing cancer, and how to take precautions. So those things are gradually getting available to most of the centers. The Hippocrates, again, Greek physician did say that walking the man's best medicine. So this is simple exercise. If you cannot do the vigorous exercise, simply just walking every day is one of the best way to really prevent cancer. And the colon cancer, which is one of the coming up very high now, is the number 20 is like beyond 20, number 20. Now it's because of high fatty acids, that there is increased formation of bile acids and fatty acids, and lead to the proliferation of the inside the lining of the colon, and which leads to in some individuals who are body not able to repair it, so they are prone to become. So actually exercise doing that by movement of the bowel, it helps with the decreased contact of the bile acids and the inside lining of the colon mucosa. So that is one way. And also, if you're taking the high fiber diet, more vegetables and fruits, it makes the stools bulky and dilute these carcinogens. Similarly, bind to the fatty acids and again help to reduce the proliferation. So these are some of the very, very simple things that taking the fiber-rich diet and regular exercise, these are and avoiding the high fat intake. So these are simple 2 or 3 steps which can really help to reduce the incidence of colon cancer. Just in the end, let me say that the poverty brings illness and illness brings poverty. This is something proverb which we know for centuries. So now there are a number of factors, like because it's 70% or even a little more, they have to pay from their own pockets. So because the cancer treatment is not a one-day treatment or 1 month treatment, it's a prolonged treatment. And after the treatment is over, you need to go to the hospital for regular visits every few months. A lot of investigations have to be done. So number of factors may be responsible which can lead to this financial crisis in the families, how to really cope up, and which is one of the reasons that high cost is one of the reasons that people sometimes stop the treatment in between or do not go for the follow-up. So this is something which really one has to take care at the national level or the government level. And what government has done today, that we have the Ayushman Bharat digital mission, and this particular scheme, which has started in 2018, provides 5 lakhs rupees to each family for treatment at secondary and tertiary care centers. So this is hope that this will be able to take care of for many of these expenditures which people have to do for the cancer treatment, and hopefully they will be able to get able to complete the treatment. Now we have the cancer screening program which has been started in 2016, and this includes the oral cancer, cervical and breast cancer. And I said that this was 34% of all cancers. The 3 cancers constitute nearly 34% of all cancers. So the scheme is that to really screen the people between 30 to 65 years of age at least once in a year. Simple way, any person who comes, do the oral visual examination for oral cavity, just check the teeth, just check if there any ulcer or anything. Similarly for cervical examination, and breast, clinical breast examination. This could be done, then you can really bring down this, pick up these people much early in the very, very stage 1 when the results of treatment are very high. And finally, the last slide, let me say the stress has been one of the factors. And as Sonamji said, so apart from the treatment, these are some of the methods like the yoga, meditation, breathing exercise in different form, either pranayam, sudarshan kriya, or something, many of these similar things, which have been our forefathers. Our people have always recommended these should be done, and which really helps in the sense that it brings down the stress to helps to bring down the stress, energizes your body, and relaxes the mind. And cancer diagnosis and treatment both are very, very stressful events. Therefore, continued regular practicing of some of the things can really help to cope up with the diagnosis and treatment, and may help to reduce the risk of relapse in many of these patients. So, just to conclude that this year the World Cancer Day, which on the 4th of February, last week, just last Friday, the theme was inequities in cancer care. So we should make efforts to close the gap. There have been so much disparities in the cancer care treatment around the world, in the racial-wise, gender-wise, because of financial reasons, because of availability of the resources in different parts of the world. So this is something we really all have to make efforts, how we can try to minimize this gap so people can get the best of treatment in their nearby places. So treatment of cancer finally is not a one-stop treatment. This starts from prevention, screening, diagnosis, and also those who have come out of the treatment for cancer, they also have to be followed up to see any long-term side effects, or those who have beyond the very, very advanced disease, beyond having terminal disease, also we have to be careful that we look after them in the last part of their life. While we are talking about some of these modern therapy, we should also not forget some of our traditional methods, the herbal-based medicines, or many of these like Ayurveda, or some of these Unani, homeopathy, and some of the age-old techniques, which also we have to really see how these can be put as a complemented with the possible available modern treatment, which not only give the harmony, but also provide a human approach. So thank you so much for your kind listening, patience listening. And these are some of the people who have helped me to get these slides made for you. Thank you so much.
Thank you so much. Thank you.
Thank you so much, Dr. Lalit Kumar, for your informative talk. And as a this thing from 11 to now from at 11 we'll start our this thing individual medical consultation.
Okay.
Thank you so much, sir.
Thank you so much. Thank you. Bye bye.